Cerebral palsy is a group of disorders that affect a person's ability to move and maintain balance and posture. It's the most common motor disability in childhood. Learning that your child has cerebral palsy may be shocking and even upsetting at first. Some parents often have countless questions and concerns that include what the future might hold for a child and how they might behave or relate with others. As the COVID-19 pandemic continues to affect the world, leaving many devastated, it's even harder for people with conditions like cerebral palsy to cope. Veronica Nabule is a caretaker of her 4-year-old grandchild who is suffering from cerebral palsy. She noticed this when he was 4 months old. She says that at birth he was yellow in color.
Doctor informed us the boy had a problem with his brain at 1 year. Feeding him is very expensive, and we are asked to feed him with food that can build his brain, as well as taking him for therapy.
Living with her grandson has not been easy. He cannot talk, sit, or chew food.
Such babies need patience. The moment you lose temper, they double theirs and refuse to eat.
For Nabule, one of the most difficult things about the COVID-19 pandemic has been the hassle of reaching hospital. Despite the challenges, Nabule says that she is happy because her grandson looks healthy and believes that one day the boy will be rehabilitated. Cerebral palsy is a condition, not a disease, according to Dr. Ambrose Asimwe. It's usually caused by injury to a mature brain or abnormal development of the brain, as he explains.
So any injury, any trauma to the brain, and this brain is still mature, we can have a condition called cerebral palsy. And this usually happens during pregnancy. We have seen that 80% of the cases of cerebral palsy happen during pregnancy, 20% happen during labor and after delivery.
He highlights the risk factors that may cause an unborn child to get cerebral palsy.
Nutritional factor. If you're a mother and you lack enough folic acid in your body, you're at high risk of giving birth a child with cerebral palsy. Then we have mothers who have had maternal infections, for example, urinary tract infections and other STIs. Most of the times when these infections cross the uterus, they can damage the immature brain.
4 out of every 1,000 babies in the country are born with this condition. The bad news is it's not curable. World Cerebral Palsy Day, which occurs annually on October 6th, reminds us that there are over 17 million people with the disorder. At Capital Center Medical Clinic in Boise, a fundraising ceremony is going to take place to support children suffering from the condition. Story by Shamim Natebwa for CTV PM Edition.